Hello and welcome. I'm Pat Toomey, Chief Medical Officer and Chief Medical Quality Officer for Essentia, and I'd like to talk to you today about living up to higher expectations. It's our Essentia Health FY13 Quality Report. At Essentia Health, our values of quality, hospitality, respect, justice, stewardship, and teamwork are the foundation of everything we do. It's no accident that quality appears first on the list of values. Patients trust us to do everything in our power to deliver the highest quality care possible. They expect quality every time they visit an Essentia Health facility. This map shows Midwestern health systems like Essentia already leading the nation in quality in measurements by the Commonwealth Fund from 2009. The Commonwealth Fund looks at measures such as access to care, prevention measures, medical treatment, and healthcare outcomes to grade states across the country. You can see in the upper Midwest and in the northeastern portions of the country, we are in the top quartile in healthcare performance. However, we still have some work to do, particularly when we compare ourselves to our regional and state cohorts who tend to perform quite well in quality. You can see the circular graphs at the top of this slide showing our current performance for disease states like diabetes, depression management, and vascular disease management, as well as colorectal cancer screening. Those are our percentage performances in those areas to give you a little bit better idea of how we compare to some of our state comparison cohort. You can see the graph at the bottom showing how we're doing in our 60+ clinics, how many are below the state average, and you can see that we still have some work to do in areas like colorectal cancer screening to get more of our clinics at or above state average. Essentia is committed to improving quality by delivering more. Patients, employers, and payers want value and quality in return for their healthcare dollars. In the past year, Essentia Health physicians, leaders, and staff have developed tools and programs designed to demonstrate our willingness to improve our quality and become more accountable to our processes, more transparent with our reporting, and more vigilant about monitoring outcomes. I'd like to talk a little bit about accountability. Essentia Health is accountable to healthcare's triple aim. When we talk about the triple aim, we're talking about a better patient experience. And by better patient experience, we mean both clinical and service quality, which includes our patient satisfaction metrics. We're also looking at better health of our overall population. At the same time, we want to lower overall healthcare costs for our patients. In fiscal year 13, Essentia laid a foundation for triple aim performance. We formed an accountable care organization. We now have contracts with multiple payers. These contracts cover healthcare for over 150,000 patients throughout Essentia. We also earned ACO certification from the National Committee for Quality Assurance, or NCQA. At the same time, we established the Essentia System Quality Management Program and Department. We have come to redefine success as a focus on value versus volume. In March, Essentia Health was among the first 6 health systems to become a nationally certified accountable care organization. This certification acts as a blueprint for quality that is recognized by patients and insurers alike. We feel that this certification establishes Essentia as a national leader in accountable care. It ensures we maintain high standards, including 25 quality measures in areas ranging from appointment scheduling to optimal chronic disease management. This accreditation hardwires the build of our standardized care processes across Essentia's health system. FY13 also saw the establishment of the System Quality Management Program and Department. In support of Essentia's mission of making a healthy difference in people's lives, the Quality Management Department is charged with leading efforts to improve performance in all areas of care, including patient safety, chronic disease management, preventive care, inpatient care, and patient experience. The department is led by myself and my dyad partner Barbara Poseen, who's the Vice President of Quality and Strategy. We have several system quality personnel who I'd like to talk a little bit about at this time, starting with Joyce Kresge, our System Quality Project Manager. Joyce has been involved in our meaningful use metrics across Essentia. She's also project manager for the CMMI Bundles of Care project, which looks at care for congestive heart failure, coronary artery bypass grafting, and total hips and knees throughout the West and East region. She also is coordinating a system safety alert communication. Cindy Ferrara, our primary care program manager, has for years been involved in Minnesota Community Measures reporting. She also oversees many of the primary care quality metrics and processes, including colon cancer screening and the Compass and Diamond mental health initiatives. Sue Hinke has been doing significant work with our NCQA accreditation preparation, practice development, and referrals tracking throughout the system, as well as access and appointments to our primary care clinics. Steve Matson is working with our quality metrics in collaboration with information management and information services. He works on developing new metrics within the quality warehouse, as well as setting metric targets for our ACO metrics, value-based purchasing, and other quality dashboards. Mickey Schultz was the project manager for our successful NCQA accreditation in FY13. She is also responsible for our balanced scorecard metrics and making sure that they are populated in a timely fashion. Marie Hellbach, our newest addition, oversees our patient experience database for both HCAHPS and CGCAHPS. She is also trained on the Truven quality database and does a lot of our statistical analysis of quality metrics throughout the system. Gail Ernst is instrumental in helping with our control charts as well as our spreadsheets across the system for quality, and does a lot of our event planning, especially in the primary care arena. Patty Fierro is our scheduling person and also works on our PowerPoint presentations for system quality. Looking regionally at our quality personnel, we have a dyad leadership model within each region. You can see here that we have in the Central region Dr. Mark Gray and Kathy Miller. In the East region, Dr. Jeff Lyon and Cindy Wilson-Nordskog. And in the West region, Dr. Michael Briggs and Claudia Volk. These folks are really your regional points of contact for quality. They help oversee such things as core measurement, performance, patient safety metrics, infection prevention, med reconciliation, readmissions processes. They also get involved in many areas in peer review, event reporting, and RCA investigations. Within the past fiscal year, we established quality committees throughout Essentia Health. We have an overriding Essentia Health Board of Directors Quality Committee, and we have a system operational quality committee. The Essentia Health Board of Directors Quality Committee meets quarterly, and the System Quality Committee meets monthly. Within the regions, then, we also have regional quality committees that meet either monthly or quarterly, as well as board-level quality committees in each of those regions. I'd like to talk a little bit about transparency in our quality metrics. Until recently, patients and insurers assumed clinical quality was a given in healthcare. Today, as more data becomes available, it's clear that quality varies among and even within U.S. hospitals and clinics. Patients are responding by seeking out this publicly reported quality data when choosing where they're going to receive their care. While this data can be found on various public internet sites, Essentia Health is taking transparency one step further by posting our key quality measures on the essentiahealth.org public website. You may have also seen posters which we have placed in most of our hospital and clinic lobbies. These posters are stating our goals in terms of quality as well as our focus on transparency for quality. And if you have a smartphone, you can click on the QR code in the lower left-hand corner of these posters, and it will bring you right to our internet quality site. When you arrive on that quality site, you will see in the lower left-hand corner here a box where you can click on any one of the metrics to get a look at how Essentia Health is performing, and also how we're performing as compared to state or national benchmarks. Clicking on high blood pressure, you can see how Essentia Health performs in treatment of patients with hypertension. You can see that our performance is 78% in this slide compared to a Minnesota state average of 75%, so we're above the state average. And you can do likewise a look at any of the quality metrics on this site to see how we're performing. We've made an effort to make sure this site is simple, understandable, and has benchmarks which will give our patients some kind of context as to how we're doing. In addition to transparency, we're also more vigilant about our outcomes than we've ever been. There's a popular saying in healthcare that you move what you measure. Thanks to a significant investment in electronic health records and our new data warehouse, Essentia Health is now able to closely monitor key health indicators for every patient in the health system. This information is being used to improve care for individual patients and for patients overall. This information drives us to better customer service and enhances care for patients with many diseases like heart disease, diabetes, hypertension, and stroke, just to name a few. Over the past year, the Quality Information Services and Information Management departments have developed the Quality Dashboard that shows our performance on key quality measures at the system, region, clinic, and physician levels. This dashboard is located on Essentia's intranet. You can find it by clicking into the source. It contains both inpatient and outpatient measures and is available to all physicians and employees within Essentia. When you get to the source, look under the Quick Links tabs over on the right hand side there, and you can see the third one down is Clinical Quality Dashboard. If you click on that, it will bring you right into the warehouse in the Quality Dashboard. Once you arrive at the Quality Dashboard, you can see that our metrics are categorized into several different buckets, and at the top there you can see it's our ambulatory care metrics. Below that we have our 30-day readmission rates for several different diseases. At the bottom we have our process of care measures, which is our care for inpatients. And then not shown here but also available on that landing page are metrics for infection prevention, mortality, patient experience, and a left without being seen metric for our ER service. You can then drill down from the system level and into regional level performance. You can see here that we've clicked into mammography compliance, and you can see how each of our 3 regions are performing for mammography. On the left hand side you can see Essentia West, Central, and East, the performance level they're currently at under value, and then you can see the red dots next to each one of those showing us that we're not quite at target yet. Just to the right of that then we have a spark line which shows our performance over multiple months. Where you see bars that are green instead of blue, that is the measurement period where we had the highest performance for that particular metric. And then to the right of that under patients you can see exactly how many patients qualify in each of our regions for mammography. Then over to the right we have a larger graph showing our system performance with the yellow line extending from left to right showing the number of patients eligible for mammography. You can see that that's been growing progressively over the previous months. And then you can see the red target up in the upper right hand corner. That the red arrow signifies what our target is for this metric. Drilling down further then into just a single region, we've clicked into the West region and we're looking actually at clinic level data in the West region, and you can see we've actually gone to the Wahpeton Clinic, and you can see that there's 2 groups of physicians in the Wahpeton Clinic that have mammography data. It's both the family medicine and the internal medicine physicians, and you can see what their performance is as well as what their spark line looks like. Drilling then one level deeper into just the family medicine docs within the Wahpeton Clinic, you can see by name how each of those physicians is performing currently and how they've performed over the last several months. You can also see that their high water marks, or the green bars, are very recent, and so their performance has been increasing in recent months. And you can also see how many patients in their patient panel are eligible for a mammography. In the coming year, we're looking at maintaining our focus on quality, and we have some highlights coming forward, beginning with system-wide training on the quality dashboard for physicians and employees. We're going to be sending out regular email updates on key quality measures, and we'll also have stories on key quality measures featured in the daily dose. We've also expanded our list of quality metrics for FY14 on the dashboard. This is our list of metrics we'll be looking at this fiscal year, and I'm just going to highlight those that have changed or been added compared to last year. Under patient experience, we have service excellence. We are now measuring the CG CAPS patient experience list of questions, which has been mandated by both state and federal payers. Under hospital measures, we've added measures for stroke patients or stroke patients and the care that they receive. And under ambulatory measures, we've added colorectal cancer screening. Under patient mortality, we are looking at overall all-cause mortality, whereas last year we were looking at mortality for just heart failure, pneumonia, or acute myocardial infarction, but this year we'll be beginning to look at all-cause mortality. Our efforts discussed today are about living up to Essentia's vision. By 2018, Essentia Health will be a national leader in providing high-quality, cost-effective, integrated healthcare services. We are already doing many things right at Essentia Health. Our next step is to make sure we do the right thing for every patient every time. Working together, we can take the quality of our care to a higher level. We will do more for our patients, and we will live up to their higher expectations by living up to our own. Please keep our mission, vision, and values in mind in all that you do. We are fortunate to work in a mission-driven profession. Thank you for your time and attention today. I'm honored to help lead this focus on quality. But the real improvement efforts come from all of you. Thanks again and have a great day.